do we evaluate your uterus and your uterine lining? The most basic test is a transvaginal sonography. On transvaginal sonography, we see the size of your uterus, we look for fibroids, we look for any polyps, we try to look if there are any congenital abnormalities or even adenomyosis. And of course, we check your endometrial lining or your uterine lining. Now this lining, the thickness will differ and the appearance will differ based on the day of your cycle. The other ways to evaluate the uterus and the endometrial cavity are doing an HSG. HSG is usually not done for the purpose of evaluating the uterus, but it is done for the purpose of evaluating the tubes. But in addition to being able to evaluate the tubes, we are also able to take a look at the uterus on the HSG. The other test to check for the uterus or the uterine cavity is doing a saline infusion sonography. In this, a catheter is passed through the vagina, through the cervix into the uterus, and some saline is passed which causes distension of the uterine cavity. So if there are any problems inside the cavity, like a polyp which is hanging inside, we can see it on the saline infusion sonography. A better test or a better investigative tool is getting a 3D sonography done. 3D sonographies are very good or very informative when we are trying to look at the details of fibroids or congenital uterine abnormalities. And of course, MRI. MRI is something that we don't usually resort to, but MRI gives us a lot of information about fibroids and about congenital uterine abnormalities.